Thank you for inviting me to this meeting. My name is Zoubir Harrat. I am from Algeria and I work at Pasteur Institute of Algeria. I am the head of parasitic disease ecoepidemiology at Pasteur Institute Algeria with the interest in epidemiology and ecology and entomology. I thank you for inviting me to this meeting, and I will present you the vector-borne disease in Algeria, the current state, and the threat we can represent to our country. I share with you the presentation. Can you?
Professor Harrat, are you sharing your screen, or would you like us to share the screen?
I share the screen.
Okay. Yes.
Sorry. Is it okay?
There seems to be a gray square in the middle. Let's hope that it goes away.
Okay. We start. As you know, vector-borne diseases continue to contribute significantly to the global burden of disease and cause epidemic that disrupt health security and cause wider socioeconomic impact around the world. All vector-borne diseases are sensitive in different ways to weather and climate condition. It's known that global change can refer to the complex environmental changes occurring in the world due to human activities. Among the environmental change, the main factor influencing the emergence of vector-borne diseases are atmospheric composition, climate change, urbanization, land use and biodiversity loss, industrial and agricultural pollution, trade, travel, and migration. These slides we can see the links between the different vector-borne diseases are impacting their epidemiology or their ecology. Some of them have a direct link, such as climate change, invasive vectors of pathogen. Others have indirect links, such as land use, trade, travel, environmental pollution. In this slide, this slide shows the major factors of medical interest which are sensitive to climate changes. Sorry. Mosquito species like Anopheles gambier complex, Anopheles phoenistus, Aedes albopictus, Aedes aegypti are sensitive to temperature changes. Increasing precipitation and relative humidity may increase the number and the quality of breeding sites for a vector like mosquitoes and the density of breeding sites. Larvae of mosquitoes mature faster in higher temperature. Larvae of mosquito mature faster in higher temperature and other famous mosquitoes digest blood faster and feed more frequently in warmer climate. which give rise or which can provoke an increase in transmission intensity. On the other hand, in female mosquitoes, the pathogen parasite, the virus microbe, complete their extrinsic incubation faster as temperature rises. There is a problem. Okay. Camille, if you can.
Camille,
Okay.
you are presenter. Can you please share the presentation?
Okay. Okay. All right. I will.
Yes.
Thank you.
We go ahead. Slide number 5. Yes. Okay. This photo taken after the floods that occurred in October 2008 in the province of Gardaya, located in the south of the country, causing at least 33 days and more than 100 people injured. As you know, storm and heavy rain frequently occurs in the late summer and autumn in the Sahara, and with the winds, they cause many losses and damage. Usually after the precipitation, we observe a peak of many cases of vector-borne diseases for both human and animals. Slide number 6, please. In this table, we can see the list of vector-borne diseases and their current status. We note that 2 of them are endemic in our country, Leishmaniasis and rickettsiosis, namely Mediterranean spotted fever. We will see later the effect of climate change on evolution of some of them. Next, please. The table shows the mandatory reporting of vector-borne diseases updated list and which are under surveillance either at national or international level according to the international health regulation. Next, please. Now we take a look for 4 examples of vector-borne diseases, and we start with the cutaneous leishmaniasis. Cutaneous leishmaniasis is a zoonotic disease transmitted to humans and mammals by the bite of females and flies, Phlebotomis papatasi in our case in Algeria and the Maghreb, which have wild rodents as a reservoir of parasites, mainly the sand rat, Thamomys obesis, and the field rat, Meriones shelby. The disease exhibits a skin lesion of varying numbers and size, and the lesion, when they heal it, they leave an permanent and unsightly scar. Next, please. Algeria is ranked second worldwide in terms of number of cases of cutaneous leishmaniasis. This disease is also ranked first among parasitic disease in Algeria. And nearly 80,000 to 10,000 new cases are recorded annually. This figure shows the evolution of the cumulative cases of cutaneous leishmaniasis between 1982 and 2017. We observe that the province or department of Sila, shown in red bar, is the department mostly affected by the disease. Next, please. Cutaneous leishmaniasis is a seasonal disease strongly influenced by variation of climate, and recurrent outbreaks are strongly linked to the annual precipitation. This figure shows the close correlation links between rainfall and the appearance of cases of the disease in the province of Department of Msila, the most active focus in Algeria. Next, please. The cycle alternation of the recurrent of the low and high incidence of cutaneous leishmaniasis over the years suggests that climate change parameter conditions as precipitation, drought, humidity, winds are the main risk factor for the spread of the disease since they act on the biotope vegetation on which rodent feed and which induces an increase in their density and similarly an increase in the density of sandflies living conjointly in their burrows. Next, please. In other hand, organic matters, organic wastes are also an important factor in the growth and proliferation of the sandflies. The huge quantities of uncontrolled garbage gathered around dwelling, outskirts of cities and on the bank of streams of rivers offer adequate habitats for both vectors and reservoirs. So please, the next please. So also unplanned and mismanaged urbanization in leishmaniasis endemic zones or areas is an important risk factor leading to the emergence of new foci of infection. This is an example. This photo shows the construction of a new building in a field of Chenopodiaceae plants where the reservoir of cutaneous leishmaniasis, Psammomus obesus, the main reservoir of the disease, is abundant. This photo was taken in the department of Msila, the main focus of cutaneous leishmaniasis. Next, please. Now we move to malaria, deadly vector-borne disease. Malaria, as you know, is a mosquito-borne vector-borne disease. It's caused by the infection with one of 5 known species from the Plasmodium genus, and Plasmodium falciparum is the most dangerous species and widely distributed. In Algeria, after several years of fighting, our country was certified by WHO as malaria-free in May 2019. And to preserve this achievement, these results, the Ministry of Health has prepared a national prevention plan for the reintroduction of to prevent the reintroduction of the disease during the period 2019 to 2021 and more, which essentially aims to keep Algeria free from malaria. Next.
Professor Harrat, you're coming up to 11 minutes.
Yes, I can finish. But the presence of Anopheles gambiae, the main vector of malaria in Africa, observed for the first time at the border with Mali in 2006, following an epidemic of Plasmodium falciparum malaria in 2017, creates a rare threat to the re-establishment or reintroduction of malaria in Algeria, especially since the migratory flow of sub-Saharan population to Algeria is steadily important. Malaria epidemic peaks. Next, please. Next slide, please. malaria epidemic peaks that have occurred in the south of the country in the past appears after the monsoon rainfall carry with them the eggs and the larvae of mosquitoes from the breeding sites along the Wadi streams from neighboring country Mali to Algeria across the border and create new breeding sites for Anopheles gambi. Next, please. Global warming can accelerate the spread of malaria northward to higher altitude due to the significant increase in evapotranspiration. The density and longevity of Anopheles are thus increased, and the risk of the emergence of malaria is high. The latest observations show a trend of in the movement of vectors of tropical species toward the north. This may explain the rise of the Anopheles gambia in Tinzawati. Next, I think it's the last. These slides, next please. These slides, next please. These slides, yes. These slides show the gradual spread of Anopheles gambia towards the north of the continent. This vector is not yet well established in Algeria, but favorable climatic and environmental factors, as well the opening of border with Mali, could consolidate its presence in the south of the country. Can I have more time to call? Yeah, thank you. Please, next, please. This is another example of spread of malaria vector from Asia to East Africa. This map shows the recent presence of Anopheles stephensi in the Arabian Peninsula and the Horn of Africa. This species is well known to be pollution tolerant, to be resistant to better to higher temperature, and to resistant to insecticide commonly used in public health than other mosquitoes. So it represents a rare threat. So for many countries, certificate malaria free in the future. Next, please. We move now. Next. Now we move for arboviral diseases. Dengue, Chikungunya, and Zika viruses are expanding in new continent and region, and more than 50 million cases per year were recorded by WHO. Recently, indigenous cases of dengue, chikungunya, and Zika were diagnosed in France and Italy in 2017 and 2018. The risk of epidemic emergence of these arbovirals is still present as long as the trillium mosquito is well established in the north of our country. Next, please. In Algeria, no indigenous cases was reported until now. However, 3 imported dengue cases were diagnosed in 2015 and 2016. They were imported from Malaysia, the Seychelles Island, and India. The maps show the geographical distribution of the Asian tiger mosquito, which now is well established in the north of the country. In the right, the map represents the cities of the capital, Algiers, with the presence of Aedes albopictus. Next, please. West Nile viruses is a seasonal disease. Several indicators are according with the circulation of West Nile viruses throughout the country, mainly in humid zones, and particularly with the national park during the period of migratory birds. In Algeria, this disease is now for a long date. However, the most deadly outbreak occurred in 1994, and in the southwest of the country in Timimou. You can see that on the map, where 50 cases were diagnosed and 8 deaths registered. In 2012, a fatal cases of meningoencephalitis caused by West Nile viruses in the north of the country at Jijel city was registered. Next. In conclusion, what are the measures to control vector-borne diseases? It's important to adapt the technique of controlling vector-borne diseases by using the appropriate procedure in their management, such in vector control, we can propose chemical and biological control, like fish as predator for mosquito larvae, impregnated bed nest trapping, and environmental management technique targeting the pathogen chemotherapy. And successful control of vector-borne diseases depends on three capacities. One, on effective surveillance to provide feedback on progress, community ownership of the new measures, a viable public health infrastructure to deliver services. And finally, in terms of regulation, many policy changes could be implemented to adapt the impact of vector-borne diseases under global change. They can involve the codification of administrative action to respond to change in distribution of vector diseases and human hosts. The measures include the change of early warning system, case detection, monitoring and reporting, public information and education, mapping using GIS or other tools. And I have finished. Thank you for your attention, and sorry for the trouble.
Thank you very much, Professor Harrat. I'm sure we'll have some questions on your talk also
Yes.
in the final discussion session. And now we move on to Professor Bojan Jelakovic from the University Hospital Center in Zagreb, Croatia. Professor Jelakovic, are you there?
Yeah, I'm here. Good afternoon. I would like to share my presentation. Okay.
We can't see your screen yet. Do you need help?
Well, it's connecting. I don't know why it's so slow.
Okay. Is it an option that Kamil shares the presentation on his computer?
I beg your pardon?
Could Kamil send? Could Kamil?
Yeah, I understand. Yeah,
yeah.
It could be also just a moment. Maybe I will. Just. Well, if not, you can do it from your side, and I will go to tell you next.
Great, let's do that.
Yeah, it's here. Okay, it's yours or mine?
This is Kamil's.
It's Camille's. Okay, fine. Okay, okay, may I start?
Yes, please.
Just to see. She will. Okay, so it's my privilege, and first I would like to thank you for this kind invitation. And in this short presentation, I will show you some data on climate changes in Croatia and blood pressure, because I am hypertensiologist and nephrologist, and this is my topic. And I'm pleased to present this on behalf of Croatian Academy of Sciences and Arts and my colleague, Professor Orlic. So please, next one. I will start just briefly with some history to inform you about meteorological observation in Croatia, because there are some interesting data. So you can see here some sporadic observations start in Croatia already in 16th century, when physician Santorio decided to evaluate quantitatively effects of Bora wind on healthy and sick persons, and made himself this balanced anemometer, thermoscope, and hygroscope, and it is interesting and important to underline that this was 20 years before Galilei designed his thermometer with liquid. A first official meteorological station in Croatia was founded in Dubrovnik in 1850, and 50 years after, there are already 146 operating stations in Croatia. Next one. So, some organized meteorological measurements started 10 years after that in Zagreb at meteorological station. And you can see here a brief history and two of colleagues who started with these meteorological systematic measurements. And here is also one world famous scientist, Andrija Mohorovičić, who was also part of the team. 2 years before, Zagreb Bridge Meteorological Station was recognized the status of Centennial Observing Station by World Meteorological Organization. At the bottom of the slide, you can see here how our building looked like in 19th century, in 20th century, and now in 21st century. So please, next one. So you can hear at that map distribution of main and ordinary meteorological station in Croatia. You can see here the whole Croatia is covered. Next one. And here you can hear another information from the past. This is instruction for observation by Andrija Mohorovičić from 19th century, from the end of 19th century, who at that time said, who is taking this moral duty to record something, he should record it either correctly or not at all. It is better nothing than bad. And this is related not only to meteorological observation, but also to blood pressure measurements, etc. So please, next one. And we are doing this correctly and properly in Croatia. And you can see here, this slide shows you time series of the mean annual air temperature and changes in the whole Croatia. On the left, you can see here data from Zagreb, the capital of Croatia. At the left bottom is a Gospić, city of Gospić in the mountain part of Croatia, and then city of Osijek, eastern part of Croatia, and finally Iceland of Hvar at the coast. It is important to see that in all parts of Croatia, it is observed in last period sharp increase of air temperature. Please, next one. And this is completely in agreement with global mean temperature differences observed worldwide. So next one, please. And this slide, you can see annual temperature changes in Croatia going on in winter and in summer, and it's completely in agreement with data coming from other countries. For instance, here you can see data from states. So global heating is also present in Croatia, as expected. So next one. We're also measuring air quality, and this is very important from many aspects, and particularly from cardiovascular disease. Please, next one. Because air pollution is recognized as important risk factor for all-cause mortality, and particularly for the cardiovascular mortality. Next one. In the last 4 decades, we also focused on bioclimate and biometeorology, because the awareness is increasing about the impact of climate changes on our health. The next one. And now we are coming to my topic, to the cardiovascular diseases and to hypertension, because this is of utmost importance, because unfortunately, cardiovascular diseases are still the main cause of death worldwide, and hypertension is the most important modifiable risk factor. And here you can see some topics from recent published papers, and you can easily read it. Seasonality of cardiovascular risk factors, seasonal variation in meteorological parameters and blood pressure, and then outdoor temperature, blood pressure, and cardiovascular disease mortality. And it is important that influence of seasonal variation on blood pressure was observed in children, adolescents, youngs, and also in elderly. And it is also important that seasonal variation in blood pressure is a complex phenomenon. It is not so simple as it might look at the first glance. So next one. So unfortunately, this is still a neglected confounder in clinical hypertension research and in clinical practice. Next one. And luckily, last year, European Society of Hypertension published this consensus document on seasonal variation in blood pressure with clear recommendations for clinical practice. Please, next one. And now we are coming to our data. These are data from my project. It's a project for Croatian Science Foundation. And this is national study on epidemiology of hypertension and salt intake in Croatia. And this is a pilot study on meteorological aspects of hypertension in Croatia. And we analyze only data from the city of Zagreb. Here you can see association of systolic blood pressure, diastolic blood pressure, heart rate, and arterial stiffness, estimated pulse wave velocity, in fact, with average daily temperature, atmosphere pressure, and air humidity. And what you can see here, that is inverse relationship between systolic blood pressure and daily temperature. Also, it is present with diastolic blood pressure. There is no relationship with heart rate and estimated pulse wave velocity. We also failed to find the association between any of parameters with atmosphere pressure. Neither we find also with air humidity, although there is a slight trend in positive association between air humidity, blood pressure, and heart rate. Please, next one. And this is in concordance with data from literature. Here you can see here data from the United States. With a much larger number of participants included in their study. Please, next one. The second analysis we have conducted is analysis of seasonal variation in blood pressure, heart rate, and arterial stiffness. And what we found is that the blood pressure was the lowest during the summer months when the air temperature was the highest. There was also a trend in heart rate and pulse wave velocity. That means arterial stiffness. Next one, please. And again, this is in agreement with data from UK, from Scandinavia, from China, and from all parts of the world. Next one, please. And of course, we found seasonal fluctuations of blood pressure, and the blood pressure was the lowest during the summer months, and it was the highest during the winter months, during the winter. Next one. And this is our another study where we analyze seasonal variation in hypertensive emergency hospitalization. We found the highest number of hypertensive emergency during the cold months, during the winter months, and the lowest hospitalization during the summer. And again, this is agreement with data coming from United States. Next one, please. Unfortunately, as I told you, this is still a neglected confounder. And because this is neglected, it could have serious consequences if this indoor blood pressure is not adjusted to outside blood pressure. We can, for instance, underestimate the blood pressure lowering effects of drugs. Well, this is serious confounding effect on the association of elevated blood pressure with cardiovascular event risk, etc. So please, next one. And this is my final slide. Well, we can easily say that ecosystem is a key determinant of blood pressure regulation in humans, as Jano concluded in his paper. And climate is beyond all other risk factors which affects blood pressure and hypertension and control of hypertension. Next one, please. But this is nothing new, because already Hippocrates emphasized the ecosystem's influences the health, disease, and therapeutic choices. And again, I'm coming back to Jano. He concluded that now is time to consider the wisdom of Hippocrates, and this wisdom should be integrated, not only can be, but should be integrated into healthcare systems and utilized for people's health. So these are data we have now in Croatia. We are trying to increase awareness about the climate effects on the blood pressure and other aspects of health. And then when we collect firm, solid data from our population, then our plan is to approach policymakers and try to negotiate with them about the plans. So, thank you very much for attention.
Thank you very much, Professor Jelakovic, and also to Professor Mirko Olic from the University of Zagreb in Croatia, who was also involved in preparing this presentation. So thank you very much. Are there any questions for our colleagues from Croatia? perhaps there'll be some questions in the later discussion sessions when it all comes together. So then I would like to invite Professor Amal Saad Hussein from the National Research Center in Egypt to please show his presentation. Are you there, Professor Saad Hussein? I can see you, but I can't hear you yet. Your microphone?
Okay,
Yes.
it's okay.
Yes, now I can hear you. Welcome.
Okay, thank you. First, I want to thank you all the organizer and the institute for sharing my presence valuable workshop. I will share my screen.
Your connection was breaking up just a little bit. Let's watch it, and perhaps it will be better if it's a problem with your presentation, then Camille might share it from his side to give you more bandwidth.
Is it presented now?
Yes, I can see it now.
So I will open the screen. I will talk today about climate change impact on health in Egypt. Egypt is located in the Middle East, North Africa region, and is considered to be a potential hotspot of climate change. The total area of the country, approximately 1 million square kilometers, and the coastal zone of Egypt extended for more than 3,500 kilometers, where more than 40% of the population live. Administratively, Egypt is divided into 27 governorates, and according to the World Bank, at 2019, the population size exceeds 100 million population.
Professor Amal, could you just click the share screen, the presentation full screen button again?
Yeah, so I must stop my screen and share it.
No, just make your PowerPoint presentation full screen.
Oh, yes. I must share it.
Yes, please.
And then to maximize.
Yes.
Is it okay now?
No, it doesn't
It's okay.
maximize. So at the bottom of your screen is at the lower right is an icon to make the PowerPoint presentation full screen. And could you click on that?
Yeah,
yes, that one.
I make it, but okay.
No, it doesn't go full screen. But I think
the problem is probably that she's sharing not the screen which is projecting full screen, but the second screen. So maybe she has to share a different screen.
I share a different screen. So
no, but it's fine. Let's just go with that. And can I ask you to switch off your camera while you're speaking so we get a better voice quality?
Yeah, it's okay. From stop video or how
yes,
can
please.
I? Yeah, it's okay.
Yes, great. Thank you. Please go ahead.
So I have a problem here. Okay. Is it okay now?
Yes, please go ahead.
Okay. So through an Egyptian French collaboration project funded by the Academy of Science of Egypt, we make a project about health mapping of infectious diseases vulnerable to climate change. Through this project, we found that we studied 8 locations here, Alexandria, Mansoura, and Asia, and Cairo, Farfara, Asyut, Hurghada, and Aswan. We noticed that the maximum temperature and the minimum temperature in these 3 areas are increasing during the study periods. We started. Oh, sorry. And through analysis of the time series through Climatex index of temperature extreme indicated that the number of hot days and nights in a year are increasing faster in Upper Egypt and along the Red Sea than the other country. The frequency of the extreme hot days in a year would reach about 80% of all at all sites in the last decade of this century. Regarding the annual precipitation, during the period of 1980 to 2017, we didn't found any significant trend, but there is a significant decrease is predicted to occur at 2010 and 2100 in the north of Africa, where rain is currently the most abundant. This slide shows climate change health impacts or the vulnerable diseases related to climate change, and I will not go through it, but I will talk about the most important disease in Egypt and what the impact of climate change on it. If we talk about schistosomiasis, it is an endemic disease. We found that the distribution map of schistosomiasis were changes and these changes were related to climate change through many mechanisms. First, yes.
Please, could you show your next slide? The slide I can see is the temperature increase. Can you click on slide 4?
Is this now the?
No.
You see this slide?
No.
Can you share the presentation?
You might be
So
best.
Yes.
Yeah, unfortunately, I don't have the presentation, so
I can send it to you.
it would be perfect if you could send it to me. Yes, please.
Yeah. So I end my presentation and I will try to send it to you just now.
I'm waiting.
Yeah. I'm trying to send it. Just a few minutes. I'm sorry for that.
We'll get it sorted.
Nina, I have some questions for the previous speakers, which I thought I will reserve for later. But does it make sense to ask now, since we're having this break?
Sorry, can you repeat that?
Yeah, sorry. I had some questions for the previous speakers.
Yes, please. Yeah,
does it make sense to? Yeah.
Sorry, okay, I sent my presentation to Dr. Kamel.
Okay, we'll have a short discussion until Kamil is available to share the slides, okay?
Okay.
Just to take the opportunity to ask everyone who's presenting, following, if they could send the presentations to me, it will be quicker. Thank you.
Okay, maybe just a very short question for the last speaker, Professor Jelagovic from Croatia. So if I understood correctly, you said that the blood pressure parameters decrease in the summer months, so they decrease with the heat increase.
Yeah.
So
Sure.
I was just trying to understand what the impact of the increase of the temperature with climate change will be on blood pressure.
Could you repeat, please?
Yeah, so the blood pressure parameters that you showed, the
Yes.
diastolic and you know, I mean they decrease with the heat increase, right? I mean during the summer months. So what would be the impact of climate change, you know, driven increase of temperature on cardiovascular diseases, essentially?
Well, you mean what could we expect related to heating? Global heating, and then one could expect that then blood pressure would decrease, and if blood pressure decreased, then the cardiovascular mortality would be lower. So it might be that it is good news, but this is not good news, because as I told you and show you, this is not simple. It's a complex, because the daily blood pressure decreases during the summer months. I showed you office blood pressure. However, the night blood pressure increases. So there are much more so-called non-dippers during the summer, and non-dippers are subjects in whom blood pressure does not decrease during the night, during the sleep. So in fact, we have decrease of daily blood pressure, but increase in nighttime blood pressure. And then, you know, this is some kind of serious situation, because many physicians and many patients started to lower blood antihypertensive drugs, and dosage is going lower because the daily blood pressure is low, but nighttime blood pressure is higher, and then they have higher risk of stroke and MI during the night, during the sleep, and particularly during the early morning.
Right, I see. I see. So you think the overall impact will be negative?
Yeah.